My name is Greg Tidd. I am a senior clinic director with Ivy ABA, currently working in Virginia Beach, Virginia at our town center location. I have been with Ivy since 2017, and I've been in the field of ABA since then. So when I think of beyond labels, what that means to me is really looking at our clients and the children we work with as just that. They are a client that has come to us, their family has come to us with a need, and we're here to kind of work with them on their individual needs, regardless of a label of an autism diagnosis or any other kind of diagnosis. We're just there to help them meet their individual goals and improve their quality of life. So with ABA, it's very individualized. So we work with the family after assessing the client to come up with individualized goals. So these goals can be for social skills. Sometimes we work on skills needed to complete activities of daily living, engage with peers, and communicate. So it's kind of all encompassing, and we can really individualize the plan to improve quality of life, especially those everyday life skills. I think parents play a huge role in the success of ABA therapy. Without them, we wouldn't know their kids, their needs, what their family needs. What we do in the center is only part of their day. The parents are with them 24 hours a day. So we rely heavily on their advice, their knowledge as parents, and we just try to teach them the skills to work with their kids on some of the goals that they have. So every client that comes to us, we do an initial assessment where we do some standardized assessments, a parent interview, and then just a direct assessment or observation. And with that, we take all of that information and combine it into a dedicated, individualized plan where the goals are developed alongside the parents, utilizing the assessments and what we saw. So each plan will look very different for each child. So different number of goals, different skills we're working on, different goals for the parents. It's all very much individualized to them and their needs. Yeah, I have, there's quite a few stories in my time with ABA, but there's two that really stand out to me. One is just working with the family. At the time, the client was 3 years old. I was brand new to the field of ABA. I just remember the client, we were working heavily on communication. The client didn't have a wide repertoire of words, but he really loved bubbles. So we've been working on how to say bubbles or some kind of approximation. And then one day he just said it after we've been working on it for months. So that was really cool to see our hard work and the parents' hard work kind of get to that point where the client was able to say bubbles, which seems like such a simple word, but that just cascaded into so many other words for him. And now he's much older now and he can communicate in full sentences. So that was really cool. And we got to do that alongside of his speech therapists and collaborating within Ivy. The second story that really stands out is another client that I worked with really had a hard time participating in any kind of therapy that he was involved in. So he was in physical therapy, occupational therapy, speech therapy, and ABA. The parents were driving all over Virginia to get to all of these different Ivy clinics. We opened a clinic where he could have all those services in one. got him comfortable with transitioning to where he was successful in all of his different therapies, including ABA. We were able to work with speech and occupational therapy to get a communication device, and he is now using that communication device independently, tolerating transitions, and has actually started school this year, which was something the parents never thought would happen. So that's a really cool additional story.